Today we have the pleasure of having Dr. Ronald Wright, an oral maxillofacial surgeon, with us. Dr. Wright, if you could please tell us a little bit about yourself.
Hi, my name is Dr. Ron Wright. I'm a board certified oral and maxillofacial surgeon. I was born and raised in St. Louis, Missouri, and I attended college at the University of Missouri. After I completed college, I went to dental school at Meharry Medical College in Nashville, Tennessee, and I graduated with honors in 1995. From day one in my dental school, I decided I wanted to be an oral surgeon. So when I finished my dental school, I applied to the residency programs across the country, and I was happy and lucky to be accepted at UCLA. I completed my residency at UCLA in 1995, so I've been practicing now for the last 15 years. Um, when I completed my residency and went into practice, private practice, I then became board certified in 1998. One thing briefly about board certification is a very strenuous and hard task. It involves a written and oral test. The written test you have to take and pass that first, and then you have to actually submit and document surgical cases to the board to then get accepted to take the oral test. I took my oral test in 1998, and I was very happy to pass and become board certified at that time. After I became board certified, I did have privileges at Hoag Hospital, and I served as chairperson of the oral and maxillofacial surgery department for 4 years. The process of privileges at the hospital is extremely involved. We take call approximately every 6 days, and including that call involves dealing with trauma cases and also patients that are admitted to the hospital for maxillofacial infections. Um, the one thing I do love about oral surgery, it is a very diverse surgical specialty. We perform multiple different surgical procedures, simply from things like extractions of teeth, including third molars or wisdom teeth. Also, we perform dental implant surgeries, including bone grafting, including the bone grafting cases or sinus lift procedures, onlay grafting, full mouth reconstruction, including taking bone from the hip and other parts of the body to reconstruct the maxillofacial complex. Also, we are able to perform IV sedation, general anesthesia. This is something that we actually is a very strong privilege for us to have. All surgeons are the only specialists that actually can perform general anesthesia, IV sedation, along with the surgical procedure at the same time.
Dr. Wright, could you tell us a little bit more about IV sedation and general anesthesia? How does that help with the patients?
Well, what we have found over the last 20, 30 years is that from the beginning, dealing with the dental field, patients come in are extremely apprehensive. Now, when you compare dental work to surgery, of course, surgical procedures make patients even more apprehensive than what you would say the normal dental treatment, including cleanings and fillings. So surgeons, we've had to find a way to make the office setting more comfortable for patients. So IV sedation, general anesthesia has made it very comfortable for patients to come to the office and have procedures done. We're able to perform everything from extraction of wisdom teeth, even surgical extractions, implant cases, and make it very comfortable for the patient in the office setting. The patient is fully monitored just like they would be in a hospital setting. And as a surgeon having surgical assistants, my assistants are also certified and trained to take care of anesthetic patients.
And then what about implants, sir? I heard you do implants.
I have placed over the last 15 years I've placed thousands of implants. When I did my residency at UCLA, we actually started placing implants in our first year, and I've actually was lucky enough to actually do a case with Professor Brennan Mark himself, and of course he is a pioneer of dental implants. Implant surgery has actually changed dentistry forever. Patients now are able to replace their missing teeth and actually have comfort and function, which is totally separate from having partial dentures or even fixed bridges. So I found implants to be very rewarding.
And then what's your take on abutment placement, sir?
As far as abutment placement, I take a lot of pride in my implant procedures. I think one issue that dentists have with surgeons when we place implants is that of course, they want the implant to first heal or integrate, and then, of course, the second most important thing is the alignment of the implant. And I actually take a lot of pride in placing implants as perfectly as possible. So at the end of the case, the general dentist has a very easy and straightforward time placing the crown. So I have usually in those cases I'm able to place the abutment and torque it for the general dentist. So then the general dentist simply has to take an impression and have it sent into the lab to have the lab fabricate the final crown. And all the dentist has to do then is adjust the bite or occlusion.
And I understand you have a huge passion for your patients too. Could you go into a little bit more detail about that?
Well, the thing is, I'm very much a people's person. I'm actually a type of person, or just being a man or a guy that when I get up in the morning, I'm very happy in the morning. So I'm able to, translate that to my patients. I think that the thing that one thing that patients really like to see when they come into an office, they have so much anxiety, they have a lot of questions, is they want to see a smiling face. They want you to make them laugh a little bit, make them feel warm and comfortable. And I think I have the ability to do that. I think when patients come in, if you can actually hear laughter coming out of the consultation room or a patient smiling about having a surgical procedure, then you've done your job. So I take a lot of pride in making patients feel extremely comfortable and reducing their anxiety. And I think it's also very important to make sure that patients are very well informed and that their options are presented to them. So when they do leave the office, they feel like, wow, I came in and the doctor answered all of my questions and I feel very comfortable with my choices. And so they feel comfortable moving forward with the procedure.
Perfect. And finally, what do you think about now that you are partnered with Implant Outreach and you are going out there? What is your feeling? What do you think about Implant Outreach and their services that they provide?
Well, there are a few things I really love about Implant Outreach. I think the foremost important thing is the patients really like having all the services performed in one office. I think over the last few years we do a lot of marketing and a lot of the questions have been asked about what makes patients happy. One thing that patients complain often about is they do not like to travel as much. So if a patient does have to be referred to a specialist, they have to go see that specialist, and if that specialist cannot treat it, they have to go see another specialist. So patients love the fact that they're able to go to a place where they have a lot of familiarity. They know the office staff, they know the doctor there, and by being there with the doctor, they have the most comprehensive care because now I don't have to necessarily call the general dentist and ask them questions about the patient. I'm able to go over the treatment plan and discuss in person, and I can discuss in person the case with the general dentist right there while the patient's there. Also, we are able to provide all the equipment and supplies, so it makes it very easy transition for the general dentist to basically just have the patient there and we're able to bring everything in. So whatever the patient needs, if it's anything from extraction of wisdom teeth, sinus lift procedure, bone grafting, dental implants, we have all the supplies to do that. And again, I also offer AV sedation, so I also bring in the equipment for that, which includes all the monitors, the crash cart, emergency supplies, and also my own staff. And like I mentioned earlier, my staff is very well trained in anesthesia and they're certified oral surgery assistants.
Now, Dr. Wright, could you please explain to us the process of IV sedation and general anesthesia? What should a patient expect, and what kind of great benefits could they receive from going under anesthesia?
Well, the biggest benefit they receive, let's first talk about what the patient will experience. The biggest benefit for the patient is basically amnesia. They have surgical amnesia. To me, the best way to have a surgery is not to remember the surgery. So if you can tell a patient that, wow, whatever I have to do, you're not going to recall anything. You can just see the smile on their face. They automatically get this huge smile because they're like, wow, I'm going to basically go to sleep, wake up, and it's over. I don't remember anything you have to do, including the injections or any bone removal, anything like that. And patients automatically, the smile is from ear to ear. That's really the best benefit. Now, the involvement for us, the protocol is fairly straightforward. We do a comprehensive health history to review their health history, make sure their medical problems are not an issue. There are times I do have to do a consultation with the person's physician. They have any medical issues that I'm concerned about. The one thing I do love about being an oral surgeon is we are extremely trained in medicine. So I'm able to easily talk to a physician about any case. If a patient has cancer, heart disease, any kind of autoimmune disease, I'm able to discuss with the patient physician and easily understand what's going on with that patient. The protocol is fairly straightforward. They have to have nothing to eat or drink for at least 6 to 8 hours prior to the procedure, and they do have to have a driver. You're after IV anesthesia, you're not able to drive yourself. In fact, you can't drive for at least 24 hours after the procedure. But again, the surgical procedure, there's a pre-op time where the patient is set up where monitors are placed. We get pre-op vital signs. And after everything is ready to go, an IV is started. And once the IV is started, the patient basically within a minute is asleep or sedated. The procedure is performed. After the procedure is performed, the patient has recovery time anywhere from 45 minutes to an hour and a half. It really depends a lot on, of course, the patient, their own, the age of the patient, and also what medications were given, how much. But the patient is fully monitored by me and my staff until they're able to be discharged.
Thank you for your time today, Dr. Wright.
Thank you.